During early childhood, especially from birth to age 2 years, there's a critical window of opportunity to shape the physical, intellectual, and emotional health and development of the young. Early childhood educational intervention provides them with a head start, both intellectually and socially. BHP Billiton has provided a 200 million rand grant to improve the health of women and young children in Africa. The project will be led by PATH, an international non-profit organization that creates sustainable, culturally relevant solutions to address health issues. This 5-year project aims to improve critical health and development services for more than 750,000 pregnant women and children in South Africa and Mozambique. It will expand and improve services in selected regions and will build on existing policies, structures, programs, and relationships at national and provincial levels. It will channel resources to build local capacity, strengthen local ownership, and ensure sustainability, helping to reduce child mortality and improve maternal health. BHP Billiton will be working with governmental and civil society partners to ensure that the PATH program will focus on improving antenatal and newborn care, infant nutrition, and child development practices, and the quality of health services and provision. The project is an African initiative and will operate in 4 South African provinces: Gauteng, KwaZulu-Natal, Mpumalanga, and the Northern Cape. During the 2nd year, PATH will launch the project in 1 district in Mozambique.
It is encouraging to note that PATH will help to provide appropriate health technologies and vital strategies that will change the way people think and act. PATH's work, we understand, fully improves global health and well-being. What is even more important is that we know PATH has the know-how needed for the challenges that lie ahead in Southern Africa with its existing health issues. But we have no doubt that this project will succeed with South Africa meeting its commitment under the Millennium Development Goal 4, which is to reduce the mortality rate for children under the age of 5 by 2/3 by 2015. At BHP Billiton, we are resourcing the future. So what better way than to play a further pivotal role in meeting the hopes and expectations of South Africa's next generation? And as such, we certainly look forward to partnering with PATH and communities where BHP Billiton has operations over the next 5 years and more. We look forward to the tremendous impact this partnership can have on the lives and development of our young children.
The advent of democracy in our country has created both opportunities and challenges. Since 1994, many initiatives have been launched and implemented to improve the efficiency of and accelerate the integration of the health system at national and provincial levels. One of the many challenges that we still face as a country is the broadening of access to health services for communities in township and rural areas. As a result, many mothers continue to lose their lives during and after childbirth, and some children barely survive through the infancy stages due to entirely preventable causes. Our host province, Mpumalanga, in line with national government priorities, has identified health as a key focus area, given its critical importance in terms of caring for women and children as the marginalized and vulnerable sectors of our society. The partnership between BHP Billiton and PATH provides a unique opportunity for our company to collaborate on an initiative that will see mothers and children benefiting from this health intervention. This initiative, amongst others, aims to reduce mother and child mortality rates and improve the quality of the health system. Furthermore, this program relies on community engagement and participation, which in turn creates an ideal platform for local communities to determine their future and take full ownership of this health initiative.
And we are excited about getting involved in improving the lives of the children in that community. The mortality rate is far too high. In South Africa, we have approximately 75,000 children that don't make it before the age of 5 years old. And that's a tragic statistic to have. And I think if BHP Billiton can impact on that in the areas in which we operate, That is a massive impact for us. In terms of BHP Billiton, this represents just one leg of the various projects we have in each of those dimensions. We have several education projects, several school and nursery schools that we've built, several health projects, and projects that improve housing and infrastructure. But this specific project focuses on that critical window of opportunity when children are born.
I'm extremely proud that BHP Billiton has embraced the Window of Opportunity project by partnering with PATH on the mission to improve the health and development of children under the age of 2 years. Mozambique still has one of the highest child mortality rates in the world. Improvements in child and maternal well-being have not been consistent across the country, and large numbers of children and women, especially those living in remote rural areas, remain at risk. PATH will work to ensure that improvements in the quality of care, range of services and child health and development outcomes continue beyond the life of the project by seeking community participation in decisions about resource allocation and service provision. As part of our commitment to the Millennium Development Goals, the Mozelle Community Development Trust has played a major role in the health sector, which has created a positive impact in the health and well-being of our community. I look forward to this opportunity and the journey to this important project, which will impact positively on the lives of young children and to reduce child mortality in Mozambique. Thank you. Together we make a difference.
For 35 years, PATH has been working with partners to improve the lives and health of women and children around the world. And through this new initiative, Windows of Opportunities, in which we're partnering with BHP Billiton, we see this opportunity to take many of these lessons and apply them at a significant scale. A few years ago, PATH started to think about the best ways we could contribute to many countries' abilities to meet their Millennium Development Goals by 2015. We know that we and other members of the global health community already have at hand many of the tools that are needed to significantly improve the lives of children, women, and communities around the world. But what we lacked was the opportunity to engage with a range of partners at a level that can take these tools to a scale in an integrated manner. Programs at this scale would not be possible without the support of the private sector. We need all partners, public and private, to come together to truly transform global health. So in BHP Billiton approached PATH about the possibility of supporting an initiative to improve the lives of young children. We realized that this was in some ways just what we were looking for, an opportunity to bring together our experience and expertise in strengthening health systems and changing behaviors with the support of a committed partner to reach millions of families in South Africa and Mozambique. Together with partners from local health and social service organizations, as well as community-based and nonprofit organizations, we have begun collaborating to give children a healthy start in life and build community capacity to support strong families. PATH has designed our approach so that we can track our progress and measure very tangible health indicators. In the end, we'll be able to show our success. So not only will we significantly improve the lives of individuals and communities through the project itself, but potentially we will define a new model that could be used by other countries or communities throughout sub-Saharan Africa, or potentially even in other regions, to help the world reach the ambitious Millennium Goals. So we're very excited about these possibilities, and PATH staff around the globe will be following the project's progress with considerable interest. We're very grateful to both BHP Billiton and the Government of South Africa for their support of this new initiative, and we look forward to using this window of opportunity to improve the health and development of children and women in South Africa.